Hello and welcome to episode 6 of Harmonia Psychology Solutions Menopause series. This episode is the first of 2 parts about the effect of menopause on mental health. So let's get into it. So what is a mental health problem? When someone has a mental health problem, the ways they think, feel and react may become difficult for them to cope with. This is in comparison to good mental health, when people generally feel, think, and react in the ways that they need to be able to live their life in the way that they want. During menopause, many women experience sudden changes in their mood. This may not be in ways which would be classified as a mental health problem, but they can still be hard to deal with. They are often experienced as feelings of sadness and low mood and are primarily caused by reductions in estrogen, which affect the brain. In order to cope with mood swings during menopause, NICE guidelines recommend that hormone replacement therapy can be taken. However, antidepressants should not be taken, as this is not the same as depression. Therapies such as cognitive behavioral therapy have also been found to be very effective. We also recommend that you practice mindfulness in order to learn to acknowledge your negative thoughts and feelings and let them go. Gratitude is also a great way to pick up your mood. You can practice gratitude by listing all the things that you are grateful for every morning or evening. It is also important to understand the relation between a healthy body and a healthy mind. Therefore, frequent exercise and a healthy diet can help to improve mood. You can find my recommendations for diet and exercise techniques throughout the previous videos. Depression has many symptoms, but is characterized by persistent feelings of unhappiness and/or hopelessness. Depressed people often lose motivation, interests, and enjoyment of things that they used to enjoy. Physical symptoms of depression include tiredness, changes in sleeping and eating, and reduced sex drive. Research has found that there is an increased likelihood of developing depression during perimenopause compared to before menopause. The level of risk is currently unknown. The falling levels of estrogen, progesterone, and testosterone during menopause result in an imbalance of chemicals such as serotonin and endorphins, and an increase in chemicals such as cortisol and adrenaline, which can lead to low mood and depression and is thought to be its cause in menopause. Women who have depression before menopause also tend to find that their symptoms worsen during perimenopause. When dealing with depression, it is important to try not to be hard on yourself, as judging yourself will only make you feel worse. Hormone replacement therapy, antidepressant medication, and/or talking therapies such as cognitive behavioral therapy are recommended to treat depression, but we also recommend planning ahead and trying to keep to a routine. This means scheduling in enjoyable activities to increase pleasure and to make you feel good each day. This can be really hard, but try to stick to your plan as it will make you feel better. Writing down any negative thoughts that come into your head and thinking about evidence which disproves these thoughts can also be helpful. The NHS also recommends trying to socialise and seek support from trusted friends and family members, as talking things through can really help. As always, maintaining a healthy lifestyle, such as a balanced diet and exercise, is also a great help here. Some other suggestions to try, which may help improve mood in depression, are acupuncture, spending time outdoors in nature, empowerment, and improving your self-esteem. And many women have found benefits from these practices. If your symptoms of depression become too much, please seek help from your GP or a licensed psychologist or therapist. Another mental health problem that can be brought about by menopause is anxiety. Clinical anxiety is excessive and overwhelming worry or fear in relatively harmless situations. Anxiety can come with or without panic attacks, and whether you get panic attacks or not, this does not make your feelings of anxiety any less valid. Physical symptoms of anxiety include feeling sick, dizzy, shaky, sweaty, tired, having a dry mouth, and trying to avoid the situations which make you anxious. It is thought that the decreasing levels of estrogen, progesterone, and testosterone in menopause influence women's brains, and the resulting imbalance causes a decrease in serotonin and endorphins, and an increase in cortisol and adrenaline, the stress hormones, which can lead to feelings of anxiousness and irritability. In order to cope with anxiety, NICE guidelines and the NHS recommend cognitive behavioural therapy or other talking therapies, as well as hormone replacement therapy and/or medication. However, there are other ways to combat anxiety. One of these ways is to practice mindfulness in an anxiety-inducing situation. You could do this by paying special attention to your breathing and controlling it consciously. Try breathing in through your nose for 10 seconds, really thinking about the breath and how it feels. Then breathe out for 10 seconds through your mouth. And imagine the anxiety leaving your body through your lungs. Meditation and yoga are another great way to bring conscious awareness to your thoughts, slow your heart rate, and relax you. Doing a fun activity which makes you happy and empowers you, such as wild swimming, can also help with feelings of anxiety. Sexual activity is also a great way to combat the reductions in happy endorphins, and reducing the amount of caffeine that you intake can also reduce anxiety, as caffeine can induce anxiety symptoms. Please remember that if you feel unable to cope with your anxiety, it is important to see your GP or a licensed psychologist or therapist. We've come to the end of part 1, but here are some more really interesting references if you'd like to read more about the information we've just given you. We really hope that you learned something interesting and helpful during this episode, and would like to take a minute to remind you that this series is for educational purposes only and does not constitute medical advice. Please see a practitioner if you are concerned about your mental health. See you next time for episode 7 and part 2 of mental health during menopause.